My name is Dr. Mارلين Mubaarak. I'm a consultant gynecologist with special interest in endometriosis, laparoscopic and hysteroscopic surgery, as well colposcopy and other gynecological problems. The test we do to check fertility, the first one is to check for ovulation. So we do a group of hormonal tests to check the ovarian reserve. In addition to that, we can do an ultrasound scan to check for ovulation, what we call follicular tracking. And in addition, we need to do a sperm test. In some women, we need to check the tubes to see if they are open or not. We know that 30% of the couple, the reason is female factor. 30% it's male factor, and in another 30% the reason is a combined female and male factor. And 10% is unexplained. However, in these 10% that is unexplained, we discovered that a lot of them have endometriosis as part of the reason for delay in pregnancy. Causes of infertility in women. One is anovulation, mainly polycystic ovarian syndrome. The second most common cause is the tube being blocked, which can be as a result of previous infection or previous surgery, or actually endometriosis itself. The third cause could be fibroids. Usually fibroids sitting inside the uterus or polyps sitting inside the uterus. They prevent pregnancy. Some women will have really large fibroid, and that affects the blood supply to the uterus itself, and that delays pregnancy. Other causes that can include ovarian reserve. When we say ovarian reserve, we are talking about the older women get, the chances of pregnancy become lower, and usually it's the age of 38. Once the woman crosses the 38 years of age, then the pregnancy rate goes down, and as well the miscarriage rate goes up. However, previous surgery on the ovaries, endometriosis, as well affects ovarian reserve. In men, the most common problem that we find is a low sperm count, which is usually related to weight, lifestyle, smoking, alcohol. However, in some cases there is no sperms whatsoever because of a certain condition they are born with or varicose veins. Hence, we advise men to see urologists to have a full assessment of their fertility and a men checkup. There are other reasons that can affect fertility in men and women. These are weight. So overweight men and women have less chances of getting pregnant. Even with IVF, their chances is reduced. Smoking affects the quality of the sperm as well the quality of the egg. So there is more risk of miscarriage and less chances of pregnancy. The first step in fertility management is diagnosis. So we need to do all the checks to see the reason why the couple are unable to have a baby. Once we do all the checks, then we treat. If the woman is not ovulating and there is polycystic ovaries, we treat that. If the tubes are blocked and it's possible to surgically open the tubes, then laparoscopic surgery is advisable. In male fertility, usually the best treatment is actually going for assisted reproduction or IVF pregnancy, because that gives the best chances. So the main aim is know why and then treat it. If there is a fibroid inside the uterus, we can do hysteroscopic surgery and shave it. So diagnosis is the first step. If you are worried about getting pregnant and you think there is a delay, the first step, go and see your gynecologist. They will take a history, they will assess you, and depending on the investigations and the result of these investigations, they will advise you what to do. In some couples, despite all the investigations are normal, they are still unable to have a pregnancy, which we call unexplained infertility. Usually, the reasons for that can be fragmentation of the sperm, which can be identified when we do sophisticated sperm tests and can be managed with some special vitamins. A lot of the time it's due to endometriosis that was not diagnosed or related to the quality of the eggs. At King's, we offer women the chance to check their fertility. That includes a hormonal test, seeing a gynecologist that will take a full history and assess them clinically, as well do an ultrasound scan. A lot of women want to delay their pregnancy because they are not ready for it because of their work commitment, and they want to know if they can do that. Hence, we offer a package investigations to check their fertility and their ovarian reserve.